Reproductive endocrinology. What is reproductive endocrinology and infertility? Reproductive endocrinology and infertility, REI, is a subspecialty of obstetrics and gynecology that focuses on the diagnosis and treatment of hormonal and reproductive disorders affecting both men and women. Reproductive endocrinologists are medical doctors who have completed additional training in this specialized field. The main areas of focus within reproductive endocrinology and infertility include hormonal disorders. Reproductive endocrinologists diagnose and manage hormonal imbalances that can affect reproductive health. This may include conditions such as polycystic ovary syndrome, PCOS, thyroid disorders, and disorders of the pituitary and adrenal glands. Female infertility. Reproductive endocrinologists assess and treat female infertility, addressing factors such as ovulatory dysfunction, tubal issues, uterine abnormalities, and conditions affecting egg quality. Male infertility. Issues related to male reproductive health, such as low sperm count, poor sperm motility, and abnormal sperm morphology, are also within the scope of reproductive endocrinology and infertility. Assisted reproductive technologies, ART. Reproductive endocrinologists are often involved in the use of advanced reproductive technologies to help individuals and couples conceive. This may include in vitro fertilization, IVF, intrauterine insemination, IUI, and other assisted reproductive procedures. Recurrent pregnancy loss. Evaluation and management of recurrent pregnancy loss, recurrent miscarriages, fall under the purview of reproductive endocrinologists. Egg freezing and fertility preservation. Reproductive endocrinologists may provide guidance and services related to fertility preservation techniques, such as egg freezing, for individuals who want to preserve their fertility for future family building. Endocrine disorders in pregnancy. Reproductive endocrinologists may also manage endocrine disorders that can impact pregnancy, such as diabetes and thyroid disorders. People seeking assistance with fertility issues or hormonal disorders related to reproduction often consult reproductive endocrinologists for a comprehensive evaluation and personalized treatment plan. These specialists work closely with their patients to explore various treatment options and help them achieve their reproductive goals. What is maternal-fetal medicine? Maternal-fetal medicine, MFM, also known as perinatology, is a subspecialty of obstetrics that focuses on managing high-risk pregnancies. Maternal-fetal medicine specialists, or perinatologists, are obstetricians who have undergone additional training to care for women with complicated pregnancies and to monitor the health of the fetus. The primary goals of maternal-fetal medicine include managing high-risk pregnancies. Maternal-fetal medicine specialists are involved in the care of pregnancies that are deemed high-risk due to various factors. These factors may include maternal medical conditions, such as diabetes or hypertension, multiple pregnancies, twins, triplets, etc., advanced maternal age, or previous complications in pregnancy. Fetal monitoring and diagnosis. Maternal-fetal medicine specialists use advanced diagnostic techniques to monitor the health and development of the fetus. This can include ultrasound examinations, fetal monitoring, and other imaging studies to detect and manage fetal abnormalities. Genetic counseling. Maternal-fetal medicine specialists may provide genetic counseling for couples at risk of having a child with a genetic disorder. They may offer genetic testing and help families understand the implications of test results. Management of pregnancy complications. Maternal-fetal medicine specialists are trained to manage various pregnancy complications, such as preterm labor, preeclampsia, and gestational diabetes. Consultation and collaboration. Maternal-fetal medicine specialists often work in collaboration with general obstetricians, family physicians, and other healthcare professionals to provide comprehensive care for pregnant women. Fetal therapy. In some cases, maternal-fetal medicine specialists may be involved in fetal interventions or therapies to address certain fetal conditions before birth. Women are typically referred to maternal-fetal medicine specialists when their pregnancies are considered high risk or when specialized monitoring and care are needed. The expertise of maternal-fetal medicine specialists contributes to improving outcomes for both the mother and the baby in complex or challenging pregnancy situations. What is gynecologic oncology? Gynecologic oncology is a subspecialty of obstetrics and gynecology that focuses on the diagnosis and treatment of cancers that affect the female reproductive organs. Gynecologic oncologists are medical doctors who have completed specialized training in both gynecology and oncology to provide comprehensive care for women with gynecologic cancers. The female reproductive organs that may be affected by gynecologic cancers include the cervix, uterus, endometrium, ovaries, fallopian tubes, vulva, vagina. Gynecologic oncologists play a crucial role in the management of various types of gynecologic cancers, including cervical cancer, arising from the cervix, the lower part of the uterus. Uterine, endometrial, cancer, originating in the lining of the uterus. Ovarian cancer, developing in the ovaries, which produce eggs and hormones. Fallopian tube cancer, affecting the tubes that transport eggs from the ovaries to the uterus. Vulvar cancer, occurring on the external genitalia. Vaginal cancer, developing in the vagina, the muscular tube that connects the uterus to the external genitals. The responsibilities of a gynecologic oncologist include diagnosis, performing diagnostic procedures, such as biopsies and imaging studies, to confirm the presence of gynecologic cancers. Treatment planning, developing personalized treatment plans based on the type and stage of cancer, which may involve surgery, chemotherapy, radiation therapy, and other targeted therapies. Surgery, performing surgical procedures to remove cancerous tumors and surrounding tissues, with the goal of removing as much of the cancer as possible. Follow-up care, providing ongoing monitoring and follow-up care to ensure the effectiveness of treatment and address any potential complications or recurrences. Gynecologic oncologists often work collaboratively with other healthcare professionals, such as medical oncologists, radiation oncologists, pathologists, and radiologists, to provide multidisciplinary care for women with gynecologic cancers. Early detection and prompt, specialized treatment are crucial for improving outcomes in gynecologic oncology. What conditions do gynecologists treat? Gynecologists are medical doctors who specialize in the health of the female reproductive system. They are trained to diagnose, treat, and manage a wide range of conditions related to the reproductive organs. Some of the common conditions that gynecologists treat include menstrual disorders, irregular periods, heavy menstrual bleeding, menorrhagia, painful periods, dysmenorrhea, contraception and family planning, birth control counseling and prescriptions, intrauterine device, IUD, insertion and removal, sterilization procedures, pelvic inflammatory disease, PID, infection of the reproductive organs, often caused by sexually transmitted infections, STIs, sexually transmitted infections, STIs, diagnosis and treatment of infections such as chlamydia, gonorrhea, and herpes, endometriosis, a condition where tissue similar to the lining of the uterus grows outside the uterus, causing pain and fertility issues. Polycystic ovary syndrome, PCOS. A hormonal disorder affecting the ovaries, leading to irregular periods, ovarian cysts, and other symptoms. Uterine fibroids. Non-cancerous growths in the uterus that can cause pain, heavy bleeding, and fertility issues. Pelvic organ prolapse. Descent or sagging of pelvic organs, such as the bladder, uterus, or rectum. Infertility. Evaluation and initial management of couples experiencing difficulty conceiving. Gynecologic cancers. Diagnosis and coordination of treatment for cancers such as cervical, uterine, ovarian, and vulvar cancers. Menopause management. Addressing symptoms associated with menopause, such as hot flashes, mood changes, and osteoporosis. Vaginal infections. Yeast infections, bacterial vaginosis, and other types of vaginal infections. Breast health. Breast exams, assessment of breast concerns, and coordination of breast imaging studies. Adolescent gynecology. Providing care and education to teenage girls about reproductive health and menstrual issues. Pelvic pain. Evaluation and management of chronic pelvic pain. It's important for women to schedule regular checkups with a gynecologist to maintain reproductive health, address concerns, and receive preventive care. Additionally, if a woman experiences any unusual symptoms or changes in her reproductive health, consulting with a gynecologist is recommended for a thorough evaluation and appropriate management. Can you see the OB/GYN if you're not pregnant? Absolutely, and it's quite common for women to see an OB/GYN even if they are not pregnant. In fact, routine gynecological care is an essential aspect of women's overall health, regardless of pregnancy status. Gynecologists provide a range of services for women throughout various life stages, from adolescence through menopause and beyond. Here are some reasons why women may visit an OB/GYN when not pregnant. Annual checkups and preventive care. Regular checkups, often called well-woman exams, are important for preventive care. These visits typically include a pelvic exam, pap smear, or pap test, breast exam, and discussions about reproductive health. Birth control consultations. OB/GYNs can provide information on and prescribe various forms of birth control to suit a woman's preferences and health needs. Menstrual issues. If a woman is experiencing irregular periods, heavy bleeding, painful periods, or other menstrual concerns, an OB/GYN can help diagnose and manage these issues. Gynecological conditions. Gynecologists diagnose and treat a variety of conditions such as endometriosis, polycystic ovary syndrome, PCOS, uterine fibroids, and pelvic inflammatory disease, PID. Sexually transmitted infections, STIs. Testing for and treating STIs is often done during routine gynecological exams. Breast health. Regular breast exams and discussions about breast health are a part of gynecological care. Preconception counseling. For women considering pregnancy in the future, OB/GYNs can provide guidance on optimizing health before conception. Menopause management. OB/GYNs can assist with managing symptoms associated with menopause, such as hot flashes, mood changes, and osteoporosis. Adolescent gynecology. Teenage girls may start seeing an OB/GYN for guidance on reproductive health, menstruation, and vaccinations. It's essential for women to prioritize their reproductive health and schedule regular visits with an OB/GYN. For routine checkups and to address any concerns or questions about their reproductive well-being. Regular gynecological care is key to maintaining overall health and catching potential issues early on. What tools does a gynecologist use? Gynecologists use a variety of tools and instruments to perform examinations, procedures, and screenings during gynecological appointments. The specific tools used can vary depending on the nature of the visit and the procedures being conducted. Here are some common tools used by gynecologists. Speculum. A speculum is an instrument used to hold open the walls of the vagina, allowing the gynecologist to visually inspect the cervix and collect samples for pap smears or other tests. Vaginal and or rectal exam gloves. Gynecologists wear gloves during pelvic examinations for hygiene and to perform manual examinations of the vagina and pelvic organs. Cytology brush and spatula. These tools are used to collect cells from the cervix during a pap smear for cytology examination. The sample is analyzed to detect abnormalities or signs of cervical cancer. Colposcope. A colposcope is a magnifying instrument with a light that allows the gynecologist to closely examine the cervix, vagina, and vulva. It is often used when abnormalities are detected during a pap smear. Ultrasound machine. Gynecologists may use ultrasound for imaging the reproductive organs. Transvaginal ultrasound involves inserting a probe into the vagina for a closer view of the uterus and ovaries. Hysteroscope. This is a thin, lighted tube that can be inserted into the uterus through the cervix. It allows the gynecologist to visually inspect the inside of the uterus and may be used for diagnostic or minor surgical procedures. Laparoscope. A laparoscope is a thin tube with a light and camera that can be inserted through small incisions in the abdomen. It is used for laparoscopic surgery to visualize and treat conditions affecting the reproductive organs. Biopsy instruments. Gynecologists may use various instruments to take tissue samples, biopsies, for further examination. This can include endometrial biopsies, cervical biopsies, or vulvar biopsies. Gyneculum. A gyneculum is a clamp-like instrument used to grasp and stabilize the cervix during certain procedures, such as inserting an intrauterine device, IUD, or performing a biopsy. Surgical instruments. In cases where surgery is necessary, gynecologists use a variety of surgical instruments, including scissors, forceps, and electrosurgical devices. It's important to note that gynecologists prioritize patient comfort and provide clear explanations of procedures. Patients are encouraged to communicate openly with their gynecologists and ask any questions they may have about the tools or procedures being used during their examinations or treatments. What can you expect during your visit to a gynecologist? A visit to a gynecologist typically involves a series of components aimed at assessing and maintaining reproductive health. Here is what you can generally expect during a routine gynecological appointment. Medical history review. The gynecologist will start by reviewing your medical history, including any previous pregnancies, surgeries, medications, and family medical history. Discussion of symptoms and concerns. You'll have the opportunity to discuss any specific symptoms or concerns you may be experiencing related to your reproductive health. Physical examination. A physical examination often includes a general health check, blood pressure measurement, and an examination of the breasts and abdomen. Pelvic examination. The gynecologist may perform a pelvic examination, which involves using a speculum to open the vagina for a visual inspection of the cervix and the collection of samples, such as a pap smear. Breast examination. A breast examination may be conducted to check for any lumps, abnormalities, or changes in breast tissue. Discussion of birth control. If applicable, the gynecologist may discuss contraception options, including birth control pills, intrauterine devices, IUDs, or other methods. Sexually transmitted infection, STI, screening. Depending on your age, sexual activity, and medical history, the gynecologist may recommend STI testing. Discussion of menstrual health. Your menstrual history will be discussed, including the regularity of your periods and any associated symptoms. Counseling on reproductive health. The gynecologist may provide guidance on reproductive health, family planning, and preconception care. Education and advice. You may receive information on various aspects of women's health, including preventive measures, lifestyle choices, and screenings. Diagnostic tests or imaging. If necessary, diagnostic tests or imaging studies may be recommended, such as ultrasound, mammography, or blood tests.